Cool.
Alrighty, so today Jess has asked me to have a chat to you guys about respiratory distress. So I just wanted to start off with, what does everybody define respiratory distress as?
Is that a question for us?
Difficulty breathing.
Is that how you just define it, just as a flat difficulty breathing?
Stress.
Inability to oxygenate.
Yeah, yourself.
Beautiful. That's what I was looking for.
Okay, cool.
Alright, so we classify it as a critical emergency case, the physical suffering of respiratory system when a patient is struggling to get the required amount of oxygen into the body. That is pretty much its definition as a whole. But yeah, you guys got it pretty much right. Who wants a chocolate?
Both of you, because you both answered it.
Yeah.
What would you like?
You just throw it. You just give her one. It's a surprise. It's a special treat.
You can have a special treat.
I'm so sorry guys, I'm fat.
And disappointed.
Alright.
I don't mind these.
Oh.
Another one for you guys.
No,
What
no
are the
one's favourite.
typical signs of respiratory distress? Use some nursing knowledge.
You're more than welcome to put butt in if you
Pale
want.
to blue gums.
Abdominal breathing.
Yep. Feel free to use technical terms if you like.
I can never pronounce it. I don't know.
That's a little one.
Have a go, Zoe. What would you describe shortness of breath and difficulty breathing as in technical?
I know it does. I can't pronounce it.
DY, yeah.
Awesome.
I can
Dyspnea.
never say.
I would have told
the
you
last part
apnea.
of it.
I would have said apnea and just do well the opposite of apnea is dyspnea. Yeah.
Well, you did pretty well. You got most of them. There's a few other ones as well.
We totally missed nasal discharge.
So, cyanosis, obviously, our blue gums, and
What's cyanosis?
cyanosis
That's blue
is
gums.
blue gums.
Cool.
I just said that. And then obviously fever, collapse, and stridor, which is that harsh
fever.
kind of grating sound
I did not know you'd get
when
a
you're
fever.
breathing, which can be from
Fever would be really,
obstruction.
I think fever would be hard to diagnose if the patient is so distressed. You wouldn't want to distress them more.
hard to know whether it's heat from
Yeah.
fever
I
or heat
suppose.
from.
Yeah, like,
If they're like,
you do get hot.
yeah, if it's like a cat like the other day that was like absolutely insane. Remember that black one that nearly drowned in the toilet?
Yes.
Like we wouldn't want to take a temperature on that one
No.
because it was trying to bite us and it had no idea of its surroundings.
Rihanna did get
It
bitten
was
when
all
she tried to do that.
off base. Yeah, so good work on that, guys. Now, what can cause respiratory distress
Drowning in a toilet.
other than drowning in a toilet?
Inhaling oxygen being one?
Sorry,
Inhaling oxygen. Inhaling liquid?
inhaling liquid. Yep. Do you want a chocolate or a whiskies?
Chocolate.
Can like fluid around the lungs and that from like severe heart disease potentially?
Chocolate or whiskies?
Name 10 answers and you'll get 10 chocolates.
I'm gonna be a sugar high by the end of the
I was
day.
like, nice.
Money!
This is all the answers in the video.
You know what I'll do next time? I'm going to get Monopoly money.
Hey?
I'm going to get Monopoly money next time.
That would be fun. Who wins this?
So we've
And then you
had
can buy your
a
chocolates.
blockage of the respiratory tract, we've had congestive heart failure.
We've had liquid being inhaled.
I hit by car.
Hit by a car. Oh, and Jess, are
No.
you too busy with your...
I went my whole.
I feel like there's a whole lot of things. I'm just
There's quite a lot.
Yeah. Well, because a hit by car could cause injuries to the
Trauma.
trauma to exactly. But I'm just trying to think.
So I got a few bits and bobs.
Cardiac
So,
arrest.
Pneumonia's a good one.
Pneumonia is a good one. Thermal burns, infections, heat stroke exhaustion is a big one.
Of course.
Oh, as if we didn't come up with that one.
Yeah, I was surprised no one came forward with
Nurses.
that one.
Failed today.
So yeah, a few different things can cause it. Obviously, that's quite a
Infections.
small list in comparison to all the things that it can cause. But I found they were the main things that I'm aware of that can be a major cause of respiratory distress. how would you say we manage when a patient is to come in for respiratory distress? What would be
What would we do?
some treatment ways in which we would manage it?
Well, put them on oxygen.
What different types of oxygen can we put them on in
Do-
terms of?
You could do flow by. Fly by. With the mask, you could do an oxygen chamber.
With that
You
ox.
could.
Yeah, sorry. No, go. It's your presentation.
Just can't
Depending
help
on
myself.
the severity of it, you could even intubate.
Mhm.
If they go into cardiac arrest.
What else? What's the specific machine that we set up if they, well, it's not a machine, but equipment that we set up for if you want them to not de-stress in an oxygen cage or you don't want them to distress in, like with a hood, we specifically insert them.
The nasal tube.
Mm-hmm.
I don't know what what's the specific name for that.
Just prongs.
Nasal prongs. One that you guys did miss as well was the, I can never pronounce this correctly. Do you want to say it, Jess?
Tracheostomy.
Thank you.
Which we will never do.
Which we'll never do, but it is something that I guess in emergency centres they would go for that option if should there be an obstruction or damage to this area of the face so they can't be intubated. So yeah, they make an incision here and they put a tube directly in so they can breathe.
So it bypasses
You
the
see?
obstruction higher up their respiratory tract.
Exactly. So yeah, you guys did well. Obviously, first off, we want to establish an airway and immediate oxygen by flow as soon as they arrive. So you've named all of our bits and bobs, which is awesome. I didn't have to show you the pictures. That's on it.
All that Kathy.
All right, if we were to use an oxygen hood, what are the concerns that we would have in using this?
Cause stress to the patient, having it on.
This is just a discussion for you guys. It's not a question and answer. So, what do we think are the major concerns that we have?
Maybe efficacy. It's not really something that, like for example, leaving the patient, pretty much with that. There are other ways of giving oxygen where you can sort of not have to be standing next to them all the time, whereas with that oxygen hood, they could potentially perforate the hood with its glad wrap or something, and
Yeah,
it's not
DIY.
working, sort of thing.
It's also can become quite hot as well.
I was going to
like
say
it
there'd be
holds
like
in the heat.
condensation.
Yeah.
So you want to make sure you have a hole at some point in that hood
To
to
escape.
provide some room air.
Which then lowers the effectiveness of the oxygen because it's escaping out of that hole.
Exactly.
Not the
So
most efficient
it's not the most effective method, but it's
Sometimes there are only options.
it might be our only option if they're not tolerating an oxygen cage or they're not
Yeah.
tolerating
Mask.
prongs, masks.
Cool. So yeah, pretty much everything that we've gone through. So knowing whether the oxygen flow is actually efficient, overheating, excess stress for the patient.
You can't check their gums either. Is it on?
Exactly.
that's one.
That's a good one.
That is a good one.
But if you wanted to
You
get
can have
mucus
another
membrane
lolly, so
somewhere else other than the
Would you like?
gums, there are
Sorry?
other
What?
spots.
Go chocolate.
I was going to say you can take the mucus membrane somewhere else in the body that's not on the head.
Thank you.
Makes me
It's
think
easy
now.
to
Oh,
dissipate.
so
I learned this last week.
Oh, yeah.
Vulva and preface.
sorry.
Oh, that makes sense. I didn't realise that
Would
would
you like
provide
chips?
an off colour.
Another.
Did you know the bulb? Oh,
What if I don't have another
Yeah, I showed the other week when we had that eye.
Do you want a cherry ripe
surgery,
or a
I couldn't check
priest?
the gums, so I showed the vulva.
Cherry ripe, okay?
Yeah, perfect. I'm not a chocolate.
Buff.
Respiratory with my chocolate.
Alrighty, so
Eat
nasal
what you got.
prongs. You guys did mention before nasal prongs is an option for us. We find that this is the best possible way to deliver oxygen if we can't place an ET tube, mainly because it's going directly in. There's no excess flow of gas around the area. However, it can be quite stressful for some patients, and it can also be difficult depending on the type of patient that it is. It's best using large dogs and brachycephalic cats and dogs, so our little squish faces animals. They're really great, but obviously it does include time to set them up as well. So usually flow by oxygen is first, and then nasal prong setup should we be able to do that by using the humidifier. Next up we have our pulse ox. So everyone here is relatively familiar with our pulse ox. Pretty much the main reason we've got this slide up here is so that we can know all the different areas that we can use during respiratory distress. Obviously putting it on the gums or the tongue is kind of out of the question. So we need to know where our other options are so we can check our oxygen levels. Obviously we need oxygen so that we can provide full oxygen to the brain and major organs and assist with cell function. And obviously reduce oxygen as time goes on once we become all healthy and good.
Quick thing just to mention, with the pulse ox, it's really good to put it in a place where they're not moving much. So like for example, if they're in respiratory distress, the main place I actually put it is on the vulva, because they will fluff around and move around a lot, but it's an area where it seems to be secure, rather than the ear where it'll just fall off on the ear because they'll be so distressed and moving their head so much, or panting ridiculously, or even just their toes. They seem to be
the best.
Yeah, they seem to be the best position rather than fiddling around the ears and their gums and all that kind of stuff.
Moving around, going crazy.
Well, I would too.
Fluid therapy. What's our thoughts on fluid therapy during respiratory distress?
It depends why they're in respiratory distress.
You don't want to overload the lungs.
So if we had a patient that didn't have fluid overload or anything like that, what
so
would
no
we do?
drowning, no heart patient. Let's say it was a trauma, maybe.
Well, if there's hemorrhage or something or blood loss, then you obviously need to compensate for blood volume in order to carry the oxygen around the body. So if there's lower blood volume in the body, blood pressure potentially is lower. So in order to increase blood pressure, you can increase blood volume. That's the only thing you can really do to assist blood pressure. But in terms of if it's definitely not congestive heart failure, do we use fluid therapy? Like I don't know.
And what about heat exhaustion case? What were your thoughts on fluid therapy for heat exhaustion?
I would say yes, but like again, if they're so hot and they're obviously dehydrated, so they would have had losses through sweating. So I would assume that they need to have it replaced, but I don't know, what do you think?
Sometimes.
What you don't want to do is put them on, for example, like shock rates, where you're trying to replace that fluid infusion too quickly. Because it's the same when you're trying to cool them down. You don't want to cool them down dramatically because you actually have to let them cool them down themselves with heat exhaustion patients now that emergency centres say. So you provide them with like the normal cooling of like ice packs and all that kind of stuff, but that's actually it. That's all you actually are supposed to do for them. So fluid therapy wise, personally, I would say yes, but only for a small amount of fluid for whatever dehydration
Also
you're replacing.
Replacement, right?
Yeah, more than shock.
Pretty much here we've written that we are really only recommending it for trauma patients, purely because you don't want to overfill the body with fluid because it will obviously congest the lungs even more and cause more issues. But yeah, as Jess was saying, for heat exhaustion patients, they're the ones that are very curious as to whether or not we do it. But yeah, general cooling I think is the best option for them. Alrighty, nursing the patient. Here's a good way for you guys to earn some extra lollies. Do's and don'ts. what are some things that we should and shouldn't do when nursing a respiratory distressed patient?
Not stress them further.
Mm-hmm.
Yes.
So, i.e. not doing anything more than what is absolutely necessary.
So, for example, if your patient we think, has fluid on the lungs, would you process to doing x-rays if they're distressed?
Nope.
Please tell your vets that.
Zoe, what would you like?
Chocolate probably.
It's not going to fix the fluid on the lungs. Just you need the vets need that diagnosis.
Can you, if you distress them further, can you kill the patient?
Yes. Yeah, because the body has to work harder and.
Then cardiac arrest.
In terms of patient position, how would you have the patient positioned?
Sternal, so both their lungs have full capacity.
I'll say lateral. I don't know why.
Why?
Tell me why.
I like this.
Well, because if they're in sternal, I feel like they can't expand it as naturally as they may in lateral.
Or whatever's comfortable for them.
Aha,
I
you
like
hit
that.
the nail
There
on
we
the head.
go.
It is pretty much the most important thing is to make sure that they're comfortable and they're not stressed by the position that they're in. If they're already stressed and you try to move them, they could become more stressed and therefore making the situation less
exacerbating it
severe.
So observe the patient's behaviour and then we'll help you determine what the patient is most comfortable in. So i.e. like you said, if they're sitting up in sternal and they're happy and then you move them and they get really distressed, well it sounds like they're probably happier in sternal.
In terms of working with the veterinarian, what should you communicate with them?
Sorry,
As
what was that?
It's a bit of a trick question.
So what will we communicate to them if they're in respiratory distress?
Observations, like
Mm-hmm.
colour,
Are we saying like what we see in the patient?
So you communicate everything to them.
Oh, okay.
So you obviously want to let them know any changes, you want to let them know all their vital signs, pretty much if the patient becomes more stressed, if the patient becomes more calm, pretty much you want to let them know everything that's going on. Minimise handing where possible. How often should you be recording changes in the patient? Or sorry, vital signs in the patient?
Every 5 minutes?
Mm-hmm. Beautiful. What would
Do
you like, Zoe?
you leave the patient?
Nope.
Nope.
Cool. I'm
Giant
liking
chocolate or whiskers?
Chocolate.
When would you start? Sorry, I'm so annoying. When would you start like reducing that checking every 5 minutes and things like that?
Once their SpO2 is a normal level, and I guess once their respiratory rates come down to a fairly normal range. Gum colour, normal.
Because and why are we checking it so often? I know that's a really stupid question, but it's
I guess because things could rapidly change.
yes.
Mhm.
Yeah,
Very quickly.
as long as we have that in our mind, we kind of treat it as though like something could happen at any point to this
Yeah.
patient. No matter what it does, it could hit its head on its cage or something. Oh, look, it's in further distress or something like that. That was a really bad.
Yeah.
But yeah, anything could change at any time. So I guess the main thing to remember when dealing with a respiratory distress patient is communication between yourself, the veterinarian and all staff on board, and regular checking until the veterinarian, I guess, gives confirmation that we're all good to slow things down. Cool. Has anyone got any questions for me before we go and do our little demonstration of the
Firstly,
humidifier?
That was excellent. Thoroughly enjoyed. Yeah.
I've learned a lot.
That's good. Yeah.
Oh.
And no.
You answer my question. Yes and no. So yeah, pretty much everything we just went through there.
I wanted to, felt like I needed to fulfill the quota of questions that I didn't know what to ask.
Everything plus more that was in the presentation slide is on here. And Jess has provided us with a lovely picture of her looking very cute to show us exactly the container that our humidifier and nasal prongs live in, which is located in the cupboard down here.
I will put a sign just on the outside of the door saying respiratory distress equipment, just to help us remember.
Yeah, it's because we have had a couple of respiratory distress
Yeah.
cases where it wasn't utilised.
Yeah.
So yeah, we'll give you a little demo of how to set this baby up.
Does anyone know what we fill the humidifier with?
Distilled water.
Yeah! Never use normal water.
You can get your
I
own
don't know
lollies
the
now.
reason why.
Alright.
Do you know the reason, Nicole, do you know the reason why we use distilled water?
Because normal water has lots of other bits and bobs in it.
Lots of microorganisms.
Thank you.
Yep, that's what we needed.
My technical terms.
Yes.
In it, and it can. Thanks. It can damage the machine.
Yes. So pretty much
So
we're
we get water
using
club.
sterile, clean water. That's what we really want to use.
So you will half fill this baby with distilled water, so to about there-ish.
Just where that line
Is there a
starts.
black line anywhere on it?
What's that line?
That line
Okay.
there.
It's literally that line.
Okay.
Yeah. I could. What I'll do, I might mark it now just so we know which line it is. There are 2 lines there. I put all the markers there and they're gone.
Pink will
Probably
do.
at my house.
So
I'm
to
definitely
the
using
pink line. I'm sure.
Looks like I'm being snorted.
You're so old, it won't matter.
To the pink line.
Yes.
And we're going to scooch on over to you guys. Oh, Jess, I thought you had hold of this.
Oh, sorry.
You totally just dropped it. Alright, so when plugging this one in, taking this one out, press it into the wall to stop it hitting aggressively at you.
Just remember, if we do have an emergency, we can't use this circuit. You have to go to the other table because the oxygen will be connected to the humidifier. So come over here, I'll show you. So this oxygen circuit for this anaesthetic machine will be disconnected if we have a respiratory patient in a cage.
Yeah.
So if you ever have an emergency.
Oh, whilst that's connected.
Yeah,
oh, sorry,
yeah.
sorry, got you. Yeah.
Sorry.
I get it.
Whilst that's connected, go to
Thank
the
you
other
for that.
table.
So you press it in
Because I've done it before.
and turn so that that's connected up to the wall.
Sis, is that you?
Yes, I have something to add from
It will
experience.
hiss at
once we've
you.
done this. For everyone's
And then
enjoyment.
the nasal prongs, let's pretend I'm an animal right now. This will come over from the back of the head and it will go down the actual nose and then go into the cavity. And then these actually get glued above the eyes on the head.
So we'll put a
Of
bit
the dog
of
or the
this tape on it, leukoplast tape, brown leukoplast tape. Attach that as like a flap, and then you'll attach the super glue. So we just use some of the vet bond. Instead of the proper super glue sticks a crap. It's so hard to get off. You have to chop the hair off. And then just super glue it to the head, and that will secure that nicely.
That's right.
And then, just so you know as well, we also have this connector bit. These are like, I've just found these recently, so these will help connect it appropriately. There's spare connectors in that container, but yeah, if you're just looking for, sometimes this doesn't connect to this, so we have this connector for that reason.
So should it just live like that always in it?
Yeah,
And there's
Just
also different
as long as-
sizes of nasal prongs as well.
So we have
Would you
cat
like-
prongs.
Are they a dog?
That's dog. So that's for like your border collie up. And then we have just small cat ones, which are quite thin. We'll show you what it looks like now.
Yeah.
I'm not sure how they're stored, but it would be good to put in like a little Ziploc bag that says cat or dog, small dog under 10.